The stakes are really high. We need to change Australia's healthcare system because we know a lot of people are missing out on care. We've also got long waiting lists and high out-of-pocket costs. And we're relying on the hospital system without enough support in the primary care or community healthcare section. It's no longer fit for purpose for the sorts of conditions and populations that we have. It's very much a system that's based on 30, 40 years ago when we had acute healthcare problems and we were funded for that. Now we've got people with chronic illness, and that's from children right through to middle age and aged care, and they're often presenting with social determinants of health. My name's Professor Harriet Hiscock. I'm a paediatrician and health services researcher, and I'll be leading the healthcare transformation area. The Transforming Healthcare team is coming together to really chart the way forward to changing healthcare. And we're going to do this obviously by listening to consumers and patients, hopefully combining health and social care and thinking about ways that we can deliver high quality, accessible healthcare that's evidence-based and based on patient values closer to home. Our work is already leading the way in some of this. For example, we've been running models of care that have successfully kept people out of hospital. We've brought health and social care together to look at how we address those social determinants of health. And we've done a lot of work in running and delivering, particularly in the cancer area, patient or people-centred value-based healthcare. We're going to be convening a series of radical ideas for her, bringing not only health into it, but hopefully engineering, business, marketing, comms, arts, all the wonderful faculties and expertise within the university, because we need to have multiple minds and multiple disciplines tackling these problems. They're wicked problems and they're not going to be solved by health alone. So success would look like a really well-functioning healthcare system where fewer people are needing to go to hospital, more people are supported in their community with their care closer to home. Health and social care will have come together to recognise and tackle the social determinants of health together, not in their silos that they currently work with, and we'll have a new funding model that rewards this sort of approach and gives a good return on investments to the state and federal governments, but in a way that places patients and people at the centre and values what healthcare that they want.